що ми робили, вони це можуть не сказати, але факти компонента. І це бівалентна чи яка. Я не знаю,
Ну, конечно, я к тебе прислушаюсь.
Це оцей, він влітку більше був, зараз у нас немає якийсь
Good morning. I want to thank everybody who joins us in Ukraine Media Center Ukrinform. My name is Olha Atamanova. It has been 10 years of the war and today is day 653 of the full-scale invasion of our homeland by Russian aggressor. And traditionally, I would like to thank all the mass media who tell the world the truth about our fight for freedom. Today we start our events with a conversation on epidemiological situation in Ukraine. We will talk about the threats and measures being taken by our medics, by our medical services. So joining us in our studio are Ihor Kuzin, Deputy Minister of Health, State Sanitary Doctor of Ukraine, and Alla Myronenko, medical doctor, virologist. So good morning, Mr. Ihor. Let's start with the situation in the country. What is it like? What are the regions that stepped over the epidemiological threshold in terms of flu and COVID-19? Well, traditionally, as the winter starts coming, we start talking about such maladies as flu, and let's not forget about coronavirus disease as well. So if we check out the statistics starting from June this year, more than 1.3 million Ukrainians fell sick with those kinds of diseases. Quite a big figure, but comparing to the previous year, the figure is bigger, almost 41%. And it's related to the fact that last year we were counting separately flu and other respiratory diseases. So this year we count epidemiological threshold using the COVID indicators. So to take a look at the bigger picture, let's look at Europe. In Europe, they report that active circulation of flu virus is still at low level, but the experience of the last year tells us that this process is intensifying usually in the end of December, so it's a little bit premature to talk about it. And if we check out the situation in Ukraine, we document the cases of COVID that results in hospitalization and difficult cases. We documented more than 80,000 cases of COVID-19 starting from the beginning of October this year, and within 1 week we hospitalized about 4,000 patients. Such patients who experience difficulties while falling sick with COVID are being hospitalized, and others who require serious medical attention. Talking about epidemiological threshold, the situation is about to change week to week, and we can emphasize that for the time being there are there's only exceeding of epidemiological threshold in Chernivtsi region, and depending on the evaluation of epidemiological situation, we impose preventive and prophylactic measures, starting with extension of winter recess for the school kids to general recommendations that we were used to when we had quarantine against COVID, such as use of masks in public places or avoidance of public places, use of disinfectors for hands, hand sanitizers. So those decisions may be taken by the local government to impose counter-epidemiological measures. So it's up to the local government in the regions. Well, local quarantine, how does it happen? Is there a restriction to enter or exit the region, or any other types of measures? Well, that was a mechanism that was in effect before the emergence of COVID-19. Many Ukrainians may have faced it when there was a notification when the winter recess was extended 1 week more. So that was a result of preventive those were the results of preventive measures. But if we don't say that this is a circulation of flu virus, the quarantine restrictions may only be related to schools. And now we see that 56 new cases are the children. So usually on the level of the region, there is a report submitted by chief sanitary doctor of the region. There is a meeting of a committee initiated who decides to impose measures to minimize the intensity of communication between the children in the school environment. So such things as additional testing, restriction of entrance to the region, or other restrictive measures usually are not used. And there is a recommended standard being imposed for, say, hand sanitizing or use of mask regimes. So this is the usual practice, the way it happens. Mrs. Alla, let's talk about the virus. How does it mutate, both the viruses of COVID and flu? So what are your observations? Well, we have to segregate here. Talking about the flu, last year we can say we had a full-fledged flu season. Both subtypes of A-type virus, H3N2 and H1N1, and type B of a Victorian line were all represented in Ukraine. So what's interesting that H3N2 that was circulating within Ukraine last season, it was added to the vaccines for the current epidemiological season. So those who fell sick with flu last season, they already have immunological defense against that type of virus. The B Austria type virus that was circulating, it was also added as a component to the vaccines to the current epidemiological season. All B-type flu viruses were all of Victorian line. Talking about H1N1 that was A Sydney in Ukraine, circulating in Ukraine, and the one added to the vaccines this season was A Victoria. And there is intensification of H1N1 virus circulating in the United States. It's close to Victoria, but the spreading is intensifying. Currently, the intensity of virus in Europe is pretty low. And talking about the viruses of SARS-2 group that result in COVID from the end of year 21, beginning of year 22, when Omicron emerged, it supplanted all other viruses, Alpha variant, Delta variant, so currently there is only Omicron mutation. And at the same time there is circulation of many subtypes of Omicron. So there is a variety, we could say. However, fortunately, this Omicron mutated so much, it has accumulated so much mutations in its spike protein, I mean the surface protein that attaches the virus to a cell, and through that protein it penetrates into the cell. So this Omicron type has mutated so much that it does not result in heavy oxygen dependence as it happened with the previous variants of COVID like Delta or Alpha, when people were dying just because they were short on oxygen or it was too late to hospitalize them. So in case of Omicron, it happens just a regular respiratory disease. However, it's still threatening to the risk groups, people above 65 and those having chronic pathologies. So this is exactly what I was going to ask you. What is the clinical picture for both flu and COVID? So, well, the flu is just like a regular flu. The beginning is different. In case of flu, the people usually have fever and then they have their respiratory symptoms manifested. And in case of COVID, it's the other way around. First the respiratory systems and then people may develop other symptoms like fever, not always very high fever. In case of children, they may even experience it without fever. So let's talk about vaccination. Does the vaccine protect us against those new types? How efficient it is, and what are people vaccinated with? Are the vaccines available and are they sufficient? Well, the vaccine protects us from complications and risk of death in terms of coronavirus infection. And now in Ukraine we use Pfizer vaccine. We also have certain amount of Johnson & Johnson 1-dose vaccine. All those vaccines are efficient against any stem of coronavirus, and it's important to understand that if you're vaccinated with a regular course, or if you were vaccinated in the beginning of the pandemics, and if you were vaccinated with AstraZeneca, the immunity that was created, it's sufficient and you don't have to look anything else. However, at the same time, the configuration of vaccines is changing across the world, and the general recommendation is such that the use of Omicron specific vaccine, the one that contains at least a couple of key components of Omicron stem, is more efficient. This is why the last week we got another batch of Omicron specific vaccine manufactured by Pfizer delivered to Ukraine. So this week and the next week it will be disseminated across the regions of Ukraine. It will be available in all regions starting from the beginning of the next week. And in case of Kyiv and other regions where vaccine was already delivered, it's been already brought to the vaccination points. So I urge everybody not to expect for a surge, and if you fall under the risk group, please get vaccinated as soon as possible. As it was mentioned, there are all subtypes of Omicron circulating inside Ukraine. If previously we were saying that the number of such substems is about 13, now this number reaches 17. We observe that they are only Omicron types, and those prevailing are XBB, against which this Omicron specific booster is pretty efficient. So let's remind our listeners and spectators about the ways to get vaccinated. Should they go to the family doctor? Well, going to the family doctor is not mandatory. You can just come to vaccination point, and the doctors who are about to perform vaccination will have all the information available for the patients. If you see that you don't have the full course of vaccination, and the full course of vaccination for Ukrainians, the basic course is 2 injections plus 2 boosters. That's the full vaccination course. If you don't have this full course, you can go to the closest vaccination point and get vaccinated there. Well, talking about children, starting with which age children can start using this Pfizer vaccine. Starting from 5 years, there is also children's vaccine available in the regions. The only specifics is that it comes in smaller numbers compared to the adult vaccine. This is why if you register your kids to get vaccinated, please make sure the children's vaccine is available at that vaccination point. So it's another separate vaccine. Yeah, it's a different thing, but it's available in the same vaccination points that provide vaccination services for the adults. So when you make an appointment for your child, please double check whether the vaccine for the children is available. Well, the information about the vaccination points is being posted on the websites of all medical services, including the Ministry of Health. Well, I cannot help but asking how many lethal cases were documented this year and how difficult is the disease this year. Well, talking about the lethal cases, we mostly talk about lethal cases resulted from COVID-19. So let's not forget that people who belong to the risk groups, they are the most vulnerable for the COVID, for the complications and the risk of lethal result. So talking about numbers, starting from October, we had 343 lethal cases, plus 2 children below 17 years, unfortunately. The main reasons, and it's important to understand why. Both flu and coronavirus infection, if a person falls sick, they have to stay at home. If they have some accompanying diseases like obesity, if they belong to a risk group, they should contact their family doctor the soonest possible, because if it's a flu, first of all, they have to be able to be diagnosed with the flu and to have their antivirus therapy assigned. So the people belonging to the risk groups should contact their family doctors the soonest possible. Another problem is that 12 million Ukrainians don't have second booster vaccinations. So basically they don't have even this basic immunity, and prevention is the fundamental of your health. So if you're not vaccinated, please come and get vaccinated. And the last recommendation, we all have to remember the experience of COVID. If you feel any symptoms and if you use public places, please use the mask. Mask is reasonable and even mandatory. What does the statistics say about vaccination? Do people continue getting vaccinated, or the war distracted us so much from vaccination from COVID that we've forgotten about it? Well, taking into account that we talk about both flu and COVID, I will probably start with flu. That for an umpteenth year, Ukraine receives batches of humanitarian vaccine against flu, and this vaccine is forwarded for vaccination of risk group persons. This year it was forwarded to the regions to vaccinate the pregnant and the medics. So within that amount that Ukraine obtained, people were able to get vaccinated. For the time being, almost 95% of that vaccine is used, which is a good sign because vaccination was timely, and we can say with confidence that certain fraction of the specialists in the medical area is well protected. The vaccine continues being available in the private market, but we see that the desire to be vaccinated against grippe is not so intense as it was last year even. Obviously, after the beginning of the full-scale invasion, the number of Ukrainians who wanted to get vaccinated fell drastically, and now we are at the level of vaccination of those people who, with presence of other accompanying diseases, come to the vaccination points, not in such big numbers. However, the vaccine is still available. Dear colleagues, please join our conversation in case you have any questions. Ukrinform, Maria Kožuhar. I wanted just to double check. Is it safe to say that the number of flu cases exceeds the COVID cases? No, it's the other way around. And then the second question about the routine vaccination of smallpox. What is the situation specifically among the children if the parents miss the second vaccination? Is it the responsibility of a family doctor to make an appointment for this measles vaccination? We know that Romania announced the epidemics of measles. So what's going on over there? Well, the situation is tense with the measles all around the world. In some of the countries, there are not only surges but significant increase of the levels of population falling sick. We understand the problem even starting with the beginning of this year. This issue was reviewed by the State Commission on Technological and Epidemiological Security, and there was a campaign initiated to vaccinate those children who missed their vaccinations or were not able to receive it in timely manner. It was expected to vaccinate about 240,000 children, and the campaign ended in the beginning of October. Within that campaign, we've vaccinated a little bit more than 153,000 people, 60% of the planned number. But what I wanted to add, 25% of those who were not vaccinated are the children who were either abroad or they were relocated to other regions of Ukraine. So basically we can say that campaign was pretty successful. The vaccine continues being available in the regions in sufficient amounts. So if a child missed vaccination or had medical reasons not to get vaccinated, they should contact their pediatrist, and the pediatrist will consult them how to correct the relevant vaccinations. And in the same way, we have to mention that in the case if we document a surge, the vaccination brigade is deployed to that place to prevent spreading of the infection if we find children there who under-received their vaccines. So for the time being, we don't document any such cases. We document some local surges that don't expand into mass infection. This is why we hope that there will be no huge surge of measles in Ukraine. We have more questions. 1+1 TSN. Can you please tell us, is there a vaccine available for mandatory vaccinations? What's going on with the vaccines for recommended vaccinations? Because according to information we have, there is no webinar in the pharmacies. Well, talking about routine vaccination, we don't see any gaps or undersupply of the vaccines in the regions. The lowest level of supply is the April, May and June last year, but we understand clearly when the next batch is coming in order not to allow any interruptions talking about the routine vaccination. So if any citizen of Ukraine observes any undersupply of vaccines, please contact the vaccination center of Ministry of Health of Ukraine to make sure the problem is solved. I think it's mostly the problem of dissemination on the level of the regions. Talking about the private market, unfortunately, we cannot influence the private market given the amount of vaccines that they import to the pharmaceutical market. It's based basically on the amounts that used to be sold earlier. So it's a very rare case when pharmaceutical companies import more vaccine than necessary. It happens mostly in the cases of Prevnar, flu vaccines, hepatitis A and B vaccines. So as soon as it's being sold, the companies supply more of them. So sometimes we do face this situation where vaccines are unavailable in the pharmacies, just like after the surge in Vinnytsia region, there were reports of absence of hepatitis A vaccines in the pharmacies. Talking about the situation in the border, it does not influence the situation with the vaccines. Hopefully the situation will be solved shortly and will result in no problems. So talking about hepatitis A in Vinnytsia surge, were we able to localize it? Well, the situation with virus hepatitis A in Vinnytsia, well, they've experienced quite a massive surge. The latest such surge in Vinnytsia region was documented in year 2001. So we got pretty high indicators, and for the time being the active phase is already over. We just see some single cases of residual nature, given the fact that virus hepatitis I is the infection disease with a long incubation period. The main focus was aimed at finding the source of infection. More than 3,500 persons that work in epidemiologically risky facilities such as retail, trade, manufacturing of food products, markets, they were all searched, and we got 9 positive cases. It's a very high indicator. The biggest indicators were coming from the markets, and the majority of the people who fell sick, they were also mentioned that they were buying some food products in the market. So the work is over, and 9 positive persons in fact have already got consulted by infectionologist, and now we can say with confidence that use of food products is safe now. But let's not forget about basic safety measures as washing fruits and vegetables, maintenance the temperature regime during cooking. So those recommendations should stay in effect for a little time from now. And after the registration of such cases, more hepatitis I vaccines were forwarded to Vinnytsia region. A number of medical employees were vaccinated in order to prevent their infection. And in total it's, give me a second. So talking about vaccination of medics, 669 of them were vaccinated against hepatitis A, mostly the specialists of the local infection hospitals and clinics. And talking about the contact persons, their vaccination is recommended for them in case they were contacting the case, and the time after the last contact does not exceed 2 weeks. Many denizens of Vinnytsia did not express desire to get vaccinated, so in those places where cases were registered, if people refused, then they were offered still to get vaccinated against virus hepatitis A. Do we have any more questions? If we have no more questions on the floor, we would like to thank you for joining our broadcast. We want to thank journalists for the interest to this topic, and we want to thank the armed forces for the opportunity to have events like this. Thank you, and glory to Ukraine.